Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the tympanic membrane. The tympanic membrane is a thin, translucent partition between the external ear and the middle ear. It is about 1 centimeter in diameter. It is pearly gray in color, oval in shape, and this is placed obliquely at an angle of 55 degree, facing forward, downward, and laterally. Outer surface is concave, inner surface is convex. Outer surface is covered by thin skin, inner surface is covered by mucous membrane. And this is the site of attachment of the handle of the malleus. The tip of the malleus is the point of maximum convexity and is called Umbo. That is like the handle of the umbrella. So this looks like a radar, the tympanic membrane. On otoscopy, in a healthy ear, cone of light reflect from the umbo to the anteroinferior quadrant in the 5 o'clock position. Okay, that is done by otoscopy. We'll see one cone of light. Okay, here is the cone of light. This is the umbo. This is the handle of the malleus. Here is the we'll get here anterior malleolar fold and the posterior malleolar fold. Here anterior malleolar fold and posterior malleolar fold. And there is a fibrocartilaginous structure at the circumference of the tympanic membrane that is attached to the tympanic sulcus of the temporal bone. This sulcus is deficient at the upper part, okay, and that is called tympanic notch. Anterior posterior malleolar fold extend from the notch to the lateral process of the malleus. The tympanic membrane has two parts. One is pars tensa, the maximum part, and the pars flaccida. The upper part is the pars flaccida between the malleolar fold. Pars tensa has 3 layers: outer cuticular layer, middle fibrous layer, inner mucous membrane layer. The middle fibrous layer has 2 types of fiber: circular fiber and radial fiber. The pars flaccida is the smaller part between the malleolar fold. Here is that between the malleolar fold is the part related to the chordae tympani nerve. Okay, here we are seeing the membrane has been removed. We are looking the chordae tympani nerve, that is the branch of the facial nerve and is more vulnerable to injury. The tympanic membrane remains tense by the inward pull of the tensor tympani muscle. So this is the tensor tympani muscle. This is the tendon. This is attached to the handle of the malleus, and it keep the tympanic membrane tense so that it can pick up the vibration from the air and send the vibration to the ear ossicle to the inner ear. So this is the tensor tympani muscle. This is innervated by the mandibular nerve. This is a nerve that is derived from the first pharyngeal arch. Structure of the tympanic membrane. We have discussed pars tensa has 3 layers. Middle fibrous layer has 2 types of fibers: circular fiber and the radial fibers. Pars flaccida is lacking fibrous layer, and pars flaccida is more vulnerable to injury. Blood supply from the branches of the maxillary artery, from the branches of the posterior auricular artery. Okay, we got that. Venous drainage, it should go to the outer part, venous blood will go to the external jugular vein, inner side will go to the transverse sinus, and will also go to the veins around the eustachian tube. Lymphatic drainage goes to the lymphatic drainage goes to the preauricular lymph node and the retropharyngeal lymph nodes. Nerve supply, outer surface, anterior-inferior part innervated by the auriculotemporal nerve, that is a branch of the mandibular nerve. Posterior superior part supplied by the vagus nerve with contribution from the facial nerve. Inner surface is getting the branch of the glossopharyngeal nerve via the tympanic plexus, goes there. So this is the choriotympanic nerve. Okay, this is the Malleus. Malleus is here. Okay, if we go to the clinical anatomy, we'll go there. One term is called myringotomy. Myringotomy is the incision of the tympanic membrane. They gave an incision here, and the otolaryngologists pick up the pus or fluid from the middle ear cavity. Idea, this is the chosen site, the posterior inferior site, because it is the site where maximum bulging take place if there is collection of fluid inside the middle ear cavity, and this part is free from the chordae tympani nerve. Perforation of the tympanic membrane may be possible. Perforation is possible. Okay, maybe due to chronic otitis media. It may be due to barotrauma in scuba diving. Okay, there may be perforation, or very big noise, continuous noise may also damage the tympanic membrane. Okay, otitis media is the inflammation of the middle ear cavity. In that condition, tympanic membrane become red and bulge, and the cone of light is lost on the otoscopic examination. And that's all about the anatomy of the tympanic membrane. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.